Health MEC Dr. Gwen Ramokgopa will be visiting the Jubilee Hospital in Hammanskraal today. This after the Tshwane facility was named the worst in the province. Let's take you live there ahead of that visit by the MEC and speak to eNCA reporter Lirandzu Themba. So Lirandzu, we're expecting MEC Ramokgopa to arrive sometime this morning. What's going on at the moment?
Well, it's not visiting hours yet here at Jubilee District Hospital, but the MEC of Health in Gauteng, Gwen Ramokgopa, has arrived. We are at the maternity ward of this 550-bed hospital here in Hammanskraal in Pretoria, where the MEC has been really just doing a walk around in an unannounced visit where she's talking to nurses and patients just to find a sense of their experiences. We know that this hospital is one of the hospitals that's been termed dangerous, Thembekile. This is obviously because of these severe sort of incidents that are taking place here. We know that they've recorded about 51 of them. And just to give you context, Baragwanath has recorded about 62 of those cases that are largely due to negligence by staff or just mistakes that really happen when it comes to the, taking care of patients here. So Baragwanath records 62, and this hospital has recorded just under 10 less compared to Baragwanath. And of course, Baragwanath Hospital is a much bigger hospital with about 3,000 beds. This hospital boasts about 550 beds. But just to get a sense of what are some of the grievances and the challenges that nurses are confronted with on a daily basis here, let's speak to a nurse or a sister. Thank you so much, sister, for joining us this morning. We saw that the MEC has come to this particular ward to find out from you, sister, what exactly are the problems that you are facing. Tell us about the challenges shortly.
Okay, the challenges that we are facing in Jubilee, this is a maternity section, and then we are running short of staff, and then we have so many patients that our hands cannot reach because we have so many clinics around us. Those clinics are not operating. So Jubilee is the only hospital that is catering all those patients from other clinics.
So basically you can't cope as the nurses that are here?
We are trying. We are not coping at all, but we are trying. So we can't reach our patient fully. The total nursing care, we don't provide for it. There's no quality of nursing care as Florence Nightingale expected us to do. So we just work for the day, and of which is not right. It's not fair to the patient, it's not fair to us.
Yeah. Let's just leave it there and get a reaction from the MEC, who's here to help you, as I understand. That's Sister Munama, who is speaking to us and who's obviously in charge of this ward that you are reporting from. But of course, the MEC of Health is here to hear those sort of problems and those grievances. And let's just hear from her what she has been listening to and her response. And just to give you also a note, Thembekile, one of the notices I saw on one of the wards is that the average waiting period in this hospital in casualty is 110 minutes. But of course, some of the people that I've spoken to said that they've been waiting here for longer periods. But of course, waiting time is a problem. Let's speak to the MEC. MEC, can you please come and join us quickly while we do have you here? Thank you so much for joining us. You are at Jubilee Hospital, one of the hospitals that's been termed quite dangerous. One of the key factors and the key complaints that have been outlined here is long waiting periods. What can be done?
I'm not sure who has termed this hospital dangerous, but this is a facility for the community. And certainly all the patients I've spoken to, they appreciate this facility. I actually met one young lady who had a very bad orthopedic problem and was admitted here, is happy with that treatment, but yes, there are issues that need to be dealt with. And she has raised that with me. One of them is water, the quality of water, which is a municipal competency. We will raise it. But I'm also aware that this area didn't have potable water. So there are huge projects out there to improve the water quality. But the two important issues that have been raised is a huge demand. Patient load has increased. And secondly, it is a shortage of staff. The patient professional ratios are very, very, very high. I've spoken to doctors. They also say they are happy with equipment state of the art. I went to radiology, they are happy with the equipment. But the doctors say if we can increase the number of doctors here because of workload. The nurses are saying if we can increase the number of nurses, including here in the maternity ward where we are. And I've actually said that this year we are prioritizing maternal and neonatal health. So we are making a call for midwives out there that the health services need you. But the patients that are here are happy with the nursing support, and they also say they need more. They think the nurses are working hard, and they also need more doctors. So absolutely, the issue of demand, patient demand. The waiting time is also high in casualty after hours and on over the weekend. For those that are P3 that are not very injured, because the injuries take precedence. We know this is the N1 route, and this hospital has got a high level of trauma. And even as we were there, I explained to the patients that the important things for us, which is one of the reasons I'm here, to understand why the Gateway Clinic, which is there to relieve those that are not very sick. They are sick enough to have left the comfort of their homes, but they do not need to be here.
Let's make some space for the patients that are supposed to be in this ward. But thank you so much for obviously explaining to that that for us, MEC. But the reasons why it is labeled a dangerous hospital is because of the fact that, I mean, just 7 years ago, 5 premature babies died in a ward just next to us. Of course, this is before your tenure, but you're obviously here to try and mitigate and make sure that such incidents don't happen, especially due to negligence. So, in a nutshell, just sum it up for us, MEC, your visit here, what are you hoping it's going to achieve?
First and foremost, I'm here to announce that we have appointed a new head of department, Professor Khululukela, who from today, the 1st of July, is permanent. He has been acting. So we've also brought him on board because of his expertise in health systems, not only as a clinician, but also as a leader in the health systems. Secondly, to also announce that there are 8 posts that have been approved for this hospital. We have 2 medical posts approved and also 4 nursing posts approved, from operational manager to professional nurses and also 1 assistant nurse. So my being here was also to assess what impact this newly approved post would be. I'm also happy that because this hospital services almost a third patients come from Northwest. The CEO has assured me that the Northwest has been paying for those patients, and that has helped to buy the equipment and also this and that. But obviously, this community needs a regional hospital. The population has increased, and we will also be opening up a 24-hour community health center in the area. And there's a clinic that is also complete that will also be opening in the next month.
So help is coming for the people that do have, grievances.
Help is definitely there. I also took time to speak to the cleaners because the cleaners need to be conscious that cleanliness can contribute to infection control and all that. I'm happy that the cleaners I spoke to are aware of that, and they have also shared with me their contribution, and that they are also an important part of the health system.
Sure.
So this facility is a very important asset for the community, and will do everything for it to improve its reputation. But I'm aware that there are complaints, and this is one of the poorly performing hospitals according to the assessment of the Office of Health Standards Compliance, and that is why we've prioritized it for posts and also to strengthen the primary healthcare services.
Fantastic. Thank you so much for giving us your time.
Thank you very much.
That was the Health MEC in Gauteng, Gwen Ramokgopa, who is really just spending her Sunday morning just walking around the wards of Jubilee Hospital, where she's also just listening to patients as well as nurses, finding out what their grievances are, but of course also bringing answers, saying that those very important positions that have been vacant for some time are going to be filled, but also making a clear call that midwives who are out there and are willing to assist, this place needs your help. Over to you.
eNCA reporter Lirandzu Themba live for us from the Jubilee Hospital in the Hammanskraal area this morning. We will continue to touch base with Lirandzu as that visit by the Health MEC continues to that particular facility.